And then as you look at the conference as a whole, outside of the AAIC session that you did on the past, present, and future of Alzheimer's disease,
Mm.
thinking more broadly about the whole body of work, what was the most surprising or even unexpected piece of research that you came across this year at AAIC?
Yeah, and again, I mean, I was there all week and just had the opportunity to get all my updates, which is the value of AIC for me. I get these really nice sort of extra bits of information about how allied professions and technical developments in other fields are developing. So the one standout, and I'm afraid at heart, Marcy, I'm a cognition guy, so I was always probably going to pick something cognitive. And the one for me was Dr. Rose Uton's presentation on the mobile toolbox. So just to give people context, one of the things we've been surprised at, honestly, is people come to see us in clinic and they say, I'm here to see you because I think there's something not good about my thinking. I'm really struggling in my current role. I'm not as good a teacher, accountant, actuary, lawyer as I used to be. And I'm really here to see you about what might be happening. And we test these people, we biomarker test them, and we find out that they're actually biomarker positive. So, for example, for amyloid. But then we measure their cognition, and we find that these very high performing individuals still are comfortably, 2 standard deviations above the mean in terms of performance on our standard measures. And we end up with people that say, well, look, I'm biomarker positive. I'm telling you things are not as good as they used to be. And you're telling me that I'm fine. It doesn't quite resonate. And when we looked at these people longitudinally, sometimes with some of the most elegant cognitive measures we can use, we've not really found much change in these people. And that begs a question. Somebody's telling us they're not as good as they used to be, and they're biomarker positive, but we're not apparently picking up either any evidence of deficit or any change across sometimes as long as 18 months. So Dr. Uton's presentation was a revelation, because I think certainly from my experience looking at digital cognitive testing, which is an advocacy that I think many of us have been making for a very long time, looking in a group of individuals, dividing them on the basis of whether they were biomarker positive for amyloid or not. In her study, using elements of the mobile toolbox, which are digital cognitive assessments, she did find a separation, and she did find evidence that people were declining in the amyloid positive group. Now, first to say, for people in that group, I'm sorry that that's the case. And it's clearly very disappointing for people who are finding that with biomarker positive, they're progressing and deteriorating with regards to their cognition. But we're looking for early evidence that those things might not be quite right. So from a methodological point of view, and for making sure we get people in the earliest stages, just so we can leverage these new medications as early as possible, it's very encouraging for us as a field to find out that we might start to have some tools which are able to pick up these early cognitive difficulties. So it was a surprise on the basis that most of the presentations I've seen and papers I've read have said, actually, we didn't find anything. Dr. Uton and her colleagues, I think she was at the Mass General Hospital when this work was done, have managed to find a combination of digital cognitive tests that do seem to have that sensitivity. So that was encouraging from a methodological point of view, but I have to say a bit of a surprise.
Uh,